Hello, I'm Vibeke Strand. I'm an adjunct clinical professor in the Division of Immunology and Rheumatology at Stanford University. And I'm pleased to present to you today the rapid and concurrent improvements in patient-reported outcomes with baricitinib from RA-Beam. So this was basically based on the methotrexate IR population, was enrolled in RA-Beam. There were 1,300 patients overall. Randomized to baricitinib 4 milligrams daily, 487 patients, adalimumab 40 milligrams every 2 weeks, 330 patients, or placebo, 480 patients, and they were still receiving methotrexate. The primary endpoint for the trial was 12 weeks. And basically, we're looking at a population that was 76, 78% female, about 10 years of disease duration. The baseline HAQ disability index was 1.6, and the mean methotrexate background dose was 15 milligrams a week. So this was to look at the speed of onset and the magnitude of improvements in patient-reported outcomes, basically at weeks 4 and 12. And for once, we're looking at the percentage changes from baseline to compare the patient-reported outcomes according to the different treatment groups. So at 4 weeks, as we might expect, baricitinib showed better improvement, faster improvement than adalimumab and placebo in patient global assessment of disease activity in pain, in HAQ, DI, and actually SF36 and morning joint stiffness. When we look at 12 weeks, then there's also a quote spidergram that compares the percentage changes across these different patient-reported outcomes. And we see that baricitinib is superior both to placebo and adalimumab in all but the facet fatigue. And overall, the improvements were better with baricitinib, as we learned from RA-Beam quite some time ago. In terms of patient global assessment of disease activity, it was 49% for baricitinib versus 42% for adalimumab and 27% improvement with placebo. Pain was quite similar, and the figures actually show how closely patient global and pain correspond. And for pain, it was 51% with baricitinib, 43% with adalimumab, and 29% with placebo. HAQ disability index was 42%, 35%, 22%. And PCS scores did not change as rapidly, but part of that is the scaling of the outcome measure, and that's 27% with baricitinib, 23% with adalimumab, and 13% with placebo. Morning joint stiffness did show differences, 46% versus 37% versus 25%. And facet F really looked quite similar because there are rapid improvements in fatigue with adalimumab, as we well know, 32% for both baricitinib and adalimumab, 23% with placebo. So basically what we see is that among these methotrexate IR patients, the responders, baricitinib and adalimumab treatments were quite similar in their rapid and concurrent improvements across the PROs. We do see statistical differences favoring baricitinib by week 12, except for the facet and PCS scores. And these significantly greater improvements with baricitinib were evident as early as week 4 in pain and patient global, and as early as week 2 also in patient global without differences in facet fatigue. Thank you.